What is endometriosis? So, endometriosis is a very painful condition which presents with severe pain during menses. And this occurs because the lining of the uterus is present outside the uterus, that is, near the ovaries, fallopian tubes, and anywhere in the pelvis. Rarely, this tissue can also be found beyond the pelvis. And because this tissue resembles the endometrial lining, it behaves also similarly. That means, just like in a menstrual cycle, how the endometrial lining thickens and then later on breaks down and there is menstruation, a similar thing is occurring but outside the uterus. And because of this, there are a lot of pathologies which are occurring in the pelvis. Like in the ovaries, you can have something called as chocolate cyst or also known as endometrioma. And in the pelvis, it leads to a lot of adhesions which cause fibrosis, and these affect the fallopian tubes and other structures in the pelvis, including the bladder and the rectum. So these patients present to us with complaints of severe pain during menses. This is the most notable clinical feature or symptom that the patient comes with. The pain can start anywhere from little before the menses and it lasts all throughout the menses when it's going on, and maybe even beyond that. But the pain is so excruciating that it literally confines them to bed or definitely prevents them from going about their daily activity. Besides this, some patients also complain of pain during passing motion or during urination, and some patients have diarrhea, constipation. Another complaint which is seen is dyspareunia, which is very, very severe, and also many patients present with infertility. So, this infertility and endometriosis is diagnosed sometimes for the first time during the workup which is going on for the infertility case. So, how do we diagnose this condition? So, there is mostly by ultrasound, MRI, and blood test. And there are many treatments available depending on the age of the patient and the extent of the endometriosis and the presenting complaint. So there is medical and surgical treatment available for the same. So in case you are suffering from anything like this, please do not neglect it and get yourself evaluated by your gynecologist.